right, we are celebrating the 2-year anniversary of Dr. Paul Nassif here at HSN, but decades in the industry as a board-certified facial reconstructive surgeon. So you probably know our faces better than we know our faces.
I know the face pretty well.
Well, and what's so great about your line is that these are doctor-approved, doctor-formulated. You spend a lot of time and research bringing us not only great products, but great ingredients that give us results. And this showstopper is something you have to look at your television screen right now, because we are tackling that oh so delicate eye area. It needs its own line of products in and of itself, because there are different needs, there are different issues that we deal with. We're giving you a duo today of the Peri Orbital Eye Complex Duo. Okay, so this has a very special formula. I mentioned ingredients, Swiss ice wine, which Dr. Nassif will speak to in just a moment, but look at these benefits you're getting, the changes you're seeing, and we were talking about this earlier.
Yeah,
it's not just the
lift.
typical lines. Yeah. Look at the lift.
Yeah, all these ladies, for a second, when you're looking at these, as Michelle's explaining the product, look at the upper eyelids. Just look at the actual lift. You know, when we're talking about these,
and I think that's the area that's so hard. Not all of us can, first of all, go in and get some crazy treatment or come see you in Beverly Hills. You know, it's not something that is doable. And you deal with a lot of high-profile clientele, and you know their needs. And fortunately for them, they can do that kind of thing. But for the rest of us, that is an area that is not easy to treat. And we start seeing it over time. You could see less and less of your makeup. You feel like your eyes are closing in just a bit. So if there is a way to take a simple cream and see results like you're seeing, this is the time to do it. We're doing a duo for you now. You're saving $20. It's a $100 value, because these are $50 each on their own. But can we just talk about the formulation, how it works, and what we'll see as we use this?
Sure. Okay. So, ladies, let me tell you this. What is the first thing that when I see patients for an aging, what we call an aging face evaluation, they say, doctor, my eyes are starting to get hooding. I'm getting that upper eyelid skin. It's starting to sag a little bit. And that's the number one thing, and that starts usually in the late 30s, early 40s. And so what do you have to do? Well, you have to fly out to Beverly Hills, and you have to do something called an upper blepharoplasty, an upper eyelid lift. That's where I'm actually removing some of the eyelid skin. So what I did, I was in Switzerland at a medical conference, and we have that picture of the frozen grapes on the vine. And I was talking to this chemist, and he found this thing, it's called Vin Uplift. And there's a product of here that, again, remember I talked about hydration, that locks in hydration, and a pilot study also showed help decrease fine lines and wrinkles, helped optimize the skin appearance of the firmness and the tone, help optimize everything about your skin. So what I did was I said, can we put this in skincare? Right. So guess what? After years of putting this together, I took the Vin Uplift, and that's why you're gonna see the lifting of the upper eyelid, also the softening of the crow's feet, and I made a product that has that. It has, again, something, remember, a quoxyl, another hydrating factor, my ethyl absorbic acid, vitamin C. It's all about the story of the active ingredients in the product. And this is a product that when I want you to use on your upper eyelid, and you can, yes, you can use this on your upper eyelid, obviously keep your eyes closed when you do it,
right,
and around your crow's feet. So you're gonna gently put it in all the way around, and I'm going to show you after you talk about it. I'm going to go walk over to the screen again.
Well, one thing I thought was interesting, and you'll know this if you've shopped our products here, is many times when you find the eye creams, they're typically a ½ ounce size. So this is a 1 full ounce. So already it's like you're doubling up here. But what's great about our showstopper value is this would be $50 any other day. So we're giving you them both for $80. So you are saving $20 there. It's free shipping and handling. You can get this on flex payments. But Dr. Nassif just explained it. I mean, all you have to do is swipe this on in those areas and let it go to work for you. He's done all the research. He's done all the hard part. And now he brings it to us in the form of a simple eye cream. And Dr. Nassif, I mean, I think the proof is in seeing it. Your before and afters are some of the best I've seen in the products that I've gotten to present here when it comes to skincare. It's amazing.
You know, I mean, so ladies, remember, my goal is to prevent you from getting on an expensive flight and coming out to see me in Beverly Hills. Even though I'd love to see you, and I'm still there for you, but I want to keep you looking young, keeping you beautiful, which you are. So let me show you something. And really, it's all about the before and afters. So this is really, I mean, come on, let's get to it. If you don't have the before and afters, what do you really have? And if you take a look at the eyelid skin. And I'm going to show you this patient from the side too in just a minute. But again, this is not anything I did with my hands in the operating room. If you take a look, especially, if you take a look at the difference here, going right to both sides, look at the difference in the before and afters. Can we see the next one now? Okay, again, look at the before.
That's huge. That is a huge difference.
And look at the depth of the crow's feet here. But look at this. Now again, look at the difference. This is something that, again, I'm not using my hands surgically, and look at this. Before, after.
She looks more awake.
Oh,
she
yes.
looks more vibrant, and that is a close-up of an eye. So imagine what that can do for you.
Can we have the next one? Okay, let's go one more before that. Here.
Wow.
I think we skipped one. Here we go. We're going to go right back to the one before that. All right, so take a look, though. If we take a look, I want to show you something. Look over here, this excess skin. And look at the difference. Take a look at this whole area, and look at the crow's feet through here, and take a look. And this is 6 weeks. Imagine using these products for 3 months. Can we have the next one? And again, these products are only used, this is 4 weeks. Look at the before and after. Look right here, and look at the lifting effect. So I want you to see the actual, this is a lifting effect. And I don't know about you, Michelle, and you've been doing this for a while, but I have never seen an eye cream lift up the eye like this.
Yeah, something like that. We're used to seeing, smoothing and plumping, and you're getting all of that with this as well, but seeing that lift, that's the difference here. That's the difference when you have a doctor-developed product as well.
I mean, and take a look at this. Look at the difference here, and look at the difference right here. Look at this softening. So again, this is what we call hooding, which makes your crow's feet worse. And then again, 4 weeks. By the way, that's an ounce. You know that when you get this, they're usually a ½ ounce.
Right.
This is gonna last you a long time, and this is why it's important to actually make sure you're using this every day around the upper eyelid. And take a look again here.
And I think the biggest frustration with this type of problem is there's nothing you can do. What can you do to prevent your eyelids from sagging down? What can you possibly do?
I have to tell you, the biggest thing what happens is you lose volume.
Right.
And that's why hydration is very important to get that lift. And take a look at the difference. Look at the difference here versus here.
And something you said that stands out too, this is after 6 weeks. So imagine if you get this home, you give it a try, and you go beyond that 6 weeks. We're not even asking you to take much time out of your day. It's a simple swipe of a cream, as Dr. Nassif said, here, around, and on the eyelid. I mean, it's a big deal. You see those before and afters. If this is an area you're constantly dealing with, and you see it all the time, you know, it's your eyes when you're putting makeup on, or you having to pull your lid up so you can get the makeup on. It makes you feel older, it makes you look older, it makes you look tired, and it's so frustrating because there really is nothing you can do except take care of yourself with the right skincare products. And this has been developed. There's a lot of research and work that's gone into this because of the special formulation as well. You're getting 2 of them today, $50 for one typically. It's $80. It's our showstopper. It's anniversary pricing. We're here to celebrate, and let's get ready. You know, as spring and summertime comes through, there's more events, there's weddings and graduations and reunions, and we want to look our best. 6 weeks from now, imagine having results like you just saw on that screen.
I mean, you have to.
It's
That's
fantastic.
why. So you're getting a lift. You're getting a lift with a Peri Orbital eye cream.
Yeah, it's
And you're
fantastic.
not seeing me in Beverly Hills.
It's fantastic. It's like your own personal appointment right now from home. And by the way, call us if you have a question for Dr. Nassif, or you have any of these products and you want to share the results that you've had. We'd love to hear from you, because we are getting a very personal appointment with one of the most